Okay, all right, so let's just say you have your nice round defect. Come on, marker. Okay, you have your defect, right? So you measure it, and it's going to be about, we'll just say 1 centimeter, okay? So from there, we're going to do the height, which is going to be 2 centimeters, okay? So you mark your little point out there. Easier said than done with this marking pen. But that's essentially your standing cone that you're going to excise with your triangle. Okay, so now we need to figure out the arc of rotation here. So I'll draw a point just about 4 centimeters to get an idea. And so you'll essentially just create a nice gentle arc. That's 4 centimeters out. So now the whole flap is kind of coming in this, the flap is rotating in that dimension, right? So this is your defect. Once again, we're going to cut that out, and the whole thing is rotating in this regard here. All right, so let me just, it'll probably be easier to just cut it and show you. All right, so blades. Oh man, I haven't used one of these in forever. All right, 10 blade is a big one. And also, whenever you're cutting, it's all about tension and counter tension, okay? If you have assistant or not, definitely utilize them to really stretch the skin and get a nice taut skin surface. So generally, if you already have the burrow triangle marked out and you're confident that that's going to come with you, I just incise the whole thing. So one thing I didn't mention too, when you make your incision, classically they tell you can't go wrong with being perpendicular to the skin edge, right? But if you really want to have a nice beveled edge, you would more or less do a very subtle out bevel on the skin. So I don't know if you can tell that orientation. It's not necessarily perpendicular, it's just subtly out, okay?
So you're just rolling about 10 degrees.
Very, very little, yeah. I think by definition about 10 to 15 degrees is what it is. So that's, yeah. But you can't go wrong if you don't overthink it. If you're just still focused on this, just do 90 degrees, right? But essentially, so, and when you're doing surgery too, you also don't be afraid to move around and position your body as you need to go. You know, I wouldn't, you know, rarely do I just stay in one place and operate. I mean, I'm constantly like this, or, you know, it may not be the best ergonomically, but you want to be comfortable and don't overthink it. Just as you would with like a pen or you're drawing or something, you know, you're constantly kind of changing your angle to cut. So essentially, let's just make our incision, just doing a slight little bevel. And with this 15 blade, and usually when I do like to use the tip of the blade. So you'll see, you know, I'm not cutting like this all the way around. I'm using the tip of this blade because that's where I get the most precision, right? Oops. All right, so let's make our incision here. And ideally, you want to just make one cut where you're going through the skin, the dermis, or the epidermis and dermis down to the subq. All right, so that's our one cut. So then you pick up where you left off. I got my tip. You know, remember the first, how you should cut is you put that tip in kind of like you're stabbing. And if this was a 15 blade, I would really bring it down a little bit, but this 10 blade's a little big. So you're just slightly beveling it, I mean 10 degrees out, and that's your cut. So when you come to the end of a cut, especially with this big old blade, you would want to just use the tip of it there, you know, because if you continue to do that, you're going to create that extra cut here. Now that's not the end of the world. In fact, some folks even recommend extending that cut so you know that you've made that complete cut. But anyway, so you have your defect. Let's just get that guy out. Now with a defect, or with a trash, or what I would call it, you know, this isn't really anything important. You can certainly pick this up with kind of any forceps you want. Now for pathology's sake, they might yell at you and they'll tell you have crush artifact in your wound if you're squeezing this too hard. But essentially, it's just very gentle tissue manipulation. And when you're excising these wounds, you really just want to stay in that plane that it gives you, which in this case, I don't even know, I guess pigs have the same planes as humans, where you're just going to be in this kind of subcutaneous plane. And if it doesn't give itself to you, that means you're in the wrong place. Like, you know, if I was superficially here, it wouldn't be dissecting as clean. But I can tell this is a natural cleavage plane. I kind of like to use the tip of my incision here. You know, I'm kind of being a lot more delicate with this than we really need to, but that's kind of the technique I would be doing if I'm peeling this off of a human's, you know, subcutaneous tissue here. So, and the whole, I was saying earlier, you really, during that first incision, you want to come through all the layers, because if you don't, and you kind of have this, you know, half-assed little incision here, this is going to be so much more difficult, and you're not going to be in the right plane. You know, it's going to make things much more difficult. So really make sure that that first cut is the depth that you want it to. But if it's not, don't be afraid to come back and retouch those depths. But anyway, you know, and I hold it just like a kind of a pencil. You know, I know they classically, you might see people make incisions like this or that. I don't think I've ever held a scalpel like that. You know, I hold it just like a pencil, very natural. Don't overthink it. You know, I'm constantly doing this with it. The more you use it, the more just like eating or like using a fork or a knife would be. Get from here. Okay, so anyway, let's get this guy out of here. All right, so that's our trash. So now you can see the defect much more clearly. It's kind of that original defect you can imagine, but we've made that triangle out of it. So now what we're gonna do is we're gonna make our cuts here. So again, I would have my assistant stretching that way. I'm stretching this way, really getting some extensibility. I'm beveling the wound, or you know, in this case, I would really just stay perpendicular to the wound here. All right, so we're just going down, nice one clean cut, come to my edge. That's where I finish with the tip. All right, so now you have all this that you need to undermine. So I would essentially, in this pig, I'm gonna undermine all this area here.
Is there kind of a ratio that you use?
I typically go about the width of the wound. You don't want to go, actually, there have been studies done, any longer than about 2 centimeters is kind of counterproductive. So I typically go about 1 centimeter. But anyway, so for this, I'm just going to rotate it for my purposes. So once again, you know, if this was a human, I would have rotated or come to the side here, because now we want to elevate this skin edge. So once again, you would use a fine pickups. Something with teeth is, so let me just show you real quick. Do you have pickups with teeth and without teeth? Classically, this would be better for tissue handling, soft tissue, but this can equally cause crushing effect. So whatever you use, you just have to be gentle with it. Just because you're using this doesn't mean you can squeeze the hell out of it. But I do like to use these because they do give me a little more control. All right. So I would probably use like a double prong skin hook here.
Raggio,
Yes, sir.
When you're working with a little thicker skin, like if they're doing on a leg or something, you try to pinch the subcutaneous layer
Correct.
of the skin.
So what Dr. Jordan means, and I don't know if you can see it here, instead of holding it like I would be here, and like if it was super thick, you know, our leg tissue is going to be much thicker than this. He's saying you would grab it underneath here, as opposed to putting these marks in the dermis here. If you can get away without grabbing the skin, do it. So he's saying grab like this subcutaneous layer, and you can just elevate from that area.
Kind of like the idea of your skin hooks.
Exactly. It's
a poor man's skin hook.
Exactly. So right, if you don't have skin hooks, then you can essentially, because right, skin hooks would just be hooking under here, right? Just like, they would essentially just be hooking like that. That's what a skin hook would do.
So damage that you cause under the skin isn't going to show up as much as damage.
Right, so that's how a skin hook would work, as opposed to, like, you don't even need to pinch it. That's causing trauma, believe it or not. So anyway, you undermine this. And some people, you can use scissors if you'd like. So you would just kind of do some spread, cut type of things. You cut your... So you can kind of do like a spread, cut. But you can see if you get too, you can get too superficial, and if you're not careful, you might buttonhole through the skin. You know, that is right at the tip. That's too superficial. So you really want to be right at that subcutaneous junction there. And you really need sharp dissection. You know, you can't do this with a hemostat or, other blunt instruments. But anyway, so that's what we're doing. We're undermining. We're going to kind of undermine this whole area here. So let's just do that. Yeah, so essentially, that's kind of what you're looking at. Let's see, let's just get a little more undermining here. And it's always good practice, I always say sharp down or knife down. You always want to communicate with whoever's helping you. So let's just get down there. All right, so we've got some decent undermining. You know, this is kind of how we do like facelifts too, you know. We essentially are elevating a giant skin flap, and you can just undermine, you know, super far under the skin. All right, so that should be plenty on that vector. And then you would, you know, want to, this is not how I would do it in a human. I can't,
So somebody tell me why, again, what's the main purpose of the undermining?
Separate from the fascial layer.
That's what undermining is,
To
but
create
what's the
the
main
flap.
purpose?
To create
What was his key first thing about getting a good?
tension lines.
or
Reducing
tension
the
free,
tension.
yeah. So right.
By undermining, you're gonna be able to stretch those things, because if it's attached, you try to stretch it, all the bottom stuff goes with it. So you lift it up and now you can stretch it.
Yeah.
Right? So that when you bring those edges together, like, if you ever see somebody that's sutured at like an urgent care, and they're all about putting the skin edges together, but they have these little scallops, because there's so much tension on the suture, they're gonna get a nasty ugly spot. So if you saw like what he, on his pictures, you do that deep layer closure, the skin edges were practically touching even before, so that when you put the skin sutures in, there's like zero tension. You're just making sure that they're touching and that they're everted.
Right.
That's how you get a good plastic. And you want it, even when you're doing it on their leg or their back and it doesn't matter,
That's when you
you
practice.
still wanna practice. That's the best place to practice. Is that what you just said? Did you
Yeah,
steal
no.
my line?
No, I was saying, even when, yeah, for ones that,
Beat me to it.
those are the best ones to practice on. If you have got like a 70-year-old lady or an 80-year-old guy and he doesn't give a crap about cosmesis, you practice your vertical mattresses or your, you know, so the ones that don't count are the ones to practice on. Not that, you know what I mean. They're not going to be doing any modeling anytime soon. You know, this is hard to,
He's gonna cover it with his shirt all the time,
right.
as opposed to the person that you're taking it off.
So once again, if I was really undermining this, I would probably get like a skin hook under here. And I mean, this is tough. I would, yeah. But you'll see. Okay, let's just a little bit more here and then we'll rotate the flap in. And I'll show you kind of a deep dermal suture that I do first. Yeah, because really you want the whole, remember, it's not just this that's moving, right? And look, that doesn't even want to move much on this. We might have to make that even more. This might be more like a scalp defect. It's not just the flap that's advancing, it's the whole perimeter. Okay, all right, so, you know, this skin probably resembles more of what you would find on like a scalp. You know, this not a lot, this hasn't really rotated much. You know, you can kind of see a little bit here. So, I don't know if you can see this. So when I'm pulling this here, you can kind of see this dog ear that's formed, this Burroughs triangle. I'm not going to necessarily excise that, but that is essentially why you take out that triangle of skin. So look, there's going to be a little more I'm going to need to take out. But essentially what you're doing now is you're able to reposition this tip to this tip over here. So that's what it's going to look like. Now, since you've undermined a little bit here, this should be able to come together here. There's a tiny little dog ear back here. It probably won't need to be corrected, but that's what we're looking at. So let's just put that together and see what happens. All right, so let's do a deep suture first. So the monochrome, once again, it's a nice absorbable suture. 5.0 is a good size, especially for the smaller tissue here. Oh man. Okay. All right, so loading up needle drivers, one thing you should definitely know. I don't know if they can see that here. But essentially, you can't go wrong with loading it kind of in the middle and using the tips of your instrument there. So let me kind of give you, that's kind of like the most basic there. But I prefer to kind of load it about a third back and just a slight bevel, or I'm sorry, a slight angle. I think that gives me the most ergonomic as a righty. Now, depending on how you like to do it, I don't ever really put my fingers in and suture that way. I'm always just holding it like this because I can get every angle I need out of that, you know, which you need in smaller areas of the face. So just, you got to practice and figure out what works best for you. And there's no right or wrong way to do it. Just do it a way that's consistent and reliable for you. Okay, so the first suture would essentially be, I would put a deep suture to try to approximate this tip to this tip here. So for these deep sutures, you may not be able to see this, but you're essentially grabbing this dermal layer, this deep dermal layer, and you want to do it buried. What I mean by that is the entry point is the depth, like the deepest in the wound, and then it comes out just right below the dermis or the epidermis. So that's your first one. Then reload it, and we're going to do the opposite side. Just pull that through. So same thing here. We're going to just gentle eversion to find just right in that subcutaneous layer. So you just kind of, should have brought my loupes with me. So you're just kind of in that strong, deep dermal layer, or what they might call the subcuticular layer, but it's not in the epidermis, it's in that dermal layer. So that's where your tension is going to be, okay? So you can see, you know, I'm able to pull the heck out of that, and it's not going anywhere.
Do you need a first assist to hold it down?
The ear? Yeah, I've never had anyone ask me that. All right. And don't be afraid to take out a suture if you don't like it. So once again, I'm just kind of doing a gentle eversion. I'm finding that deep dermal layer. So that's pretty strong there. We'll see if that holds up on the pig. And typically, with good forceps, you can grasp it and pull it out. You really don't want to grab the tip of the needle because that's going to blunt it. You really just want to use the body of it here. So in like a good forceps, you would be able to grab that.
Would it be easier to grab?
Mm-hmm. It would. Okay, so let's get this deep dermal bite. So once again, this is what we're getting, this layer here. Not the dermis, but kind of the, I'm sorry, not the epidermis, but the deep dermal layer. And a good rule of thumb is you kind of want to just come in parallel to the skin edge, and then you just do a little pronation, and that should just grab the same amount that you grabbed on that side. So once again, strong. Strong tissue there in that dermis. Let's see, where's my guy here? All right, so when you do these, it's just simply like y'all have done before, where you can do your instrumentize, you know? Yeah.
Have you been showing the instrument?
I mean, I can barely see this. So, yeah, instrumentize, essentially just to recap, you put your instrument in the middle of one end and your other end. You would do 2 loops around it. And then grab your other side. So that will... So that broke because there wasn't a strong enough bite there. I don't know if there will be with that tension. Let's try it one more time. If not, you know, another good thing to do too, actually, and this is probably what I would do in practice on this patient, is, where's that nylon? It's much easier to throw that first kind of guideline bite with just a, the first guiding bite with just a dermal suture, because that'll kind of keep you. Let me show you what I mean. So instead of doing that deep dermal one, which is a little harder, you can essentially just do, you know, your bite through here, it's right through the tip. And then, so like Dr. Jordan was mentioning earlier, sometimes it may not be a good idea to try to get it all in one bite. I think I can do it in this case. But you would just approximate them first with this epidermal suture. So look, there was too much tension, it came out, so we have to do 2 bites, right? And then you just come to the edge where you're coming in through. And I'm taking a big bite because this is a lot of tension on this pig ear. And this may not even hold it either. But this will be the one that's going to kind of line you up. So you might have your assistant in this case, you know, put some tension on this initially. So I'm sorry. What I meant by that is take the tension off of it. So you would, hold on. Like you would push the ear. Yeah, perfect. Let's try that. So let's see, there might be a little, this may not be strong enough, this 5-0 for the skin. This is too thin. Because this breaks pretty easily. Like watch how easily this breaks just if you were to pull it too hard. Like it's very delicate. It probably would have held, but I really need like a stronger. Are there any like 3/0s or 4/0s in there?
It doesn't. Power is negligible.
All right, well let's just see. Oh, that feels good. Yeah, so what I was trying to get you to do is kind of like hold that there. Yeah, that way when I tie it down, it doesn't have any tension on it.
I tried to prop those doors open, but there's nothing to keep them open with.
Yeah, that's essentially it. This may not hold. I mean, this is so thin.
Broke down one day, and it was like 85 degrees in there. And the dermatologist I worked with.
That's good. You can let go there. But essentially, once you get that first one going, you really just implement the rules of halving. So what I mean by that is you would do like first you would do.
Oh, there it goes.
You would do one like there, and then you would do one half of this distance, so you would do there. Then you would do one half of that distance, which means there, and so on and so forth. So you could do half of that, which would be there. That's kind of the rules of halving. Now you can see here that there's still a significant standing cone deformity here. So we're probably going to have to, and I'll just show you there right now. Where's that tin blade? So for standing cone deformities, essentially, don't overthink it. You're just trying to take out this excess skin that's bunching out. So you can just kind of pull whatever you have excess there, and you can kind of see. That's why you need tissue for something like that. So it's essentially just this extra skin that I'm holding that's kind of extra, right? So you just kind of make a little cut, and you just cut it out. And that was really all that was extra on this guy. And so then that'll close better. All right, well, let's just put a few more in just to show you. So that was essentially the rotational advancement flap. The real tenants are just the, you know, the 4 to 2 to 1 ratio. And so one thing I wanted to show you too, when you come into the skin, I was talking about how you don't necessarily go perpendicular, but rather you want to out bevel or angle out your needle just a tiny bit. So once again, you're not going parallel into it. You're going out a little bit, okay? So then you, once you go in, then you rotate your, and pronate your wrist here.
So we have 2/0 silk is black.
Oh yeah, that would actually be a good demonstration too.
Yeah. So that would show up for the tan.
So then the same thing, other side. And let's see, this may not be strong enough, but let's see. So this doesn't really feel strong enough, but go ahead and put that, like push that up that way. See, that just broke. Let's do the silk. Pig requires the silk. Once again, the only things you really use on the skin are going to be nylon and Prolene. You really don't use silk on it. Here, let's put this guy too. Where did? Okay.
Sharp skin tanner.
Mm-hmm. Yeah, so this is much more robust. So once again, you're not coming in, you know, you don't do this type of maneuver where you're coming in and, because that seems real easy to do and the right thing to do. That needle needs to be really accentuated out that way when you're doing, if you really want good wound eversion. And then you would pronate your wrist. So you enter kind of the skin like that. Is that a needle? Is that a cutting needle?
I don't know. I think it's a cutting.
Yeah.
Yeah.
But anyway, so look, like for in that instance, I had to make 2 bites because there's too much tension. I couldn't do it all in 1 bite. So then you just make sure you line up across opposite way here. And really, you can't go, when you're coming in from this aspect, really, you got to try to think, you know, when we went into the skin and we really accentuated the bevel out that way, we kind of have to do the same way this way. So I don't want you necessarily, it's really got to be accentuated to where you're, try to think of if the needle was coming in from this angle, how it would look from the underside, if that makes sense. So remember, we're not going perpendicular into it. You want to bevel it out a tiny bit. So it's kind of, if you look at the PowerPoint, you'll be able to conceptualize what I'm talking about. Jeez. So just a simple interrupted with the silk here. All right, so your assistant is taking the tension off the wound by pushing those together. You know, and for a wound like this that has this much tension, you really want to utilize, I would probably do deep dermal sutures on here for sure. So that's, or if for whatever reason, like say this skin was super thin like this, a vertical mattress may not be a bad idea here, or a horizontal mattress. Now, you can see silk, it's kind of hard to, it's not the best. But that's essentially what the rotational flap is. I think the other flap we would practice is probably the note flap, because that's the most robust. But if y'all want to practice doing some of these and just drawing out the defects and then sewing those up, that's essentially it. So then you would just sew it up, once again, the rules of half, where you half the distance between here to here. So that would be my next one. And then my next one would be half that distance between here to here. So that would be my next one. That's essentially it. Same thing for here too. You know, you would do this, do from here to here, and then your next one would be kind of the split distance between here to there. That's essentially it. But these are